first child?
Yes.
Yeah, I bet it's sitting down. It's back to precious one. So this is Miss Shauna Vasco Mitchell. Right? So the baby, a boy, was born at 2:28 a.m. this morning. So this is a New Year's baby. First for San Fernando General. Okay? The experience was good. It was really right. How long you will be? 8 hours. Not too bad. You will have any questions for Ms. Vasco?
Any names, Miss Bascom? Any names?
Phil, the document, Phil, you know what's up?
Phil,
Just relax now, brother.
yes, the back of it, Phil.
Right, you will have any questions?
Phil, yes.
His name is Shadow.
You're listening?
Born at 2:28 a.m. So this is the first baby born on New Year's Eve in San Fernando. First one for San Fernando. Nice and pink and healthy. Test.
It was a bit challenging, but it's rewarding. Yes, yes.
Alright, that's the fight today. Fight amongst yourselves.
Yes, normal. Natural birth. Shiloh Mitchell. The name represents the Messiah, meaning he who was sent and given love and commitment.
I am fighting amongst yourselves.
Yes, I knew. Well, actually, it was a tale to be something. But we have to do slaves. So cute. He's here today. Firstborn. We are in San Fernando General. Couldn't have so anything better. My name is Shauna Vasco Mitchell.
It is not good. That's the one.
So, Shona, how do you feel to be the first small baby to be in 2020? 2020 is a very special year.
I feel very special. I have a little star in my eyes.
So by you know, every New Year's Day is big party.
Well, yes, I'm invited.
I am right. Oh, by the way, the parent who gave birth to Hollis, who has accepted my challenge to call her baby Terrance, has asked me to be the godfather of the child, which I have accepted with pride and pleasure. So I will be the godfather of that baby.
What is the first grade?
That when I go to the Christian, I will let you know I got. No. When I went Christmas Day. Yeah. On New Year's Day I comes up.
So she asked you to be godfather as well?
Who's that?
That parent?
Yes, that parent who agreed to call her baby Terrance as a middle name has asked me to be the godfather, and I have accepted with pride and pleasure.
Everyone is ecstatic. Yes. We have seen pictures of it. Nothing else. Ready for the family. Yes.
What time did you wake?
20. Okay, so I think we have tied off mommy enough. Yeah, and we have we have this for you. Yes.
Just for the presentation.
For you, celebrate the birth of the first baby at San Fernando Hospital. All the best to you. Okay? Alright. Okay, so let's get walking up now.
Can we? Video until video journey photo. This camera on the video journey.
Yeah.
Okay? Thank you. No, let's leave you alone now. So we have here, the mother's name is Valdez. Huh? So where we have?
Ivan, can you roll my mic over there? Thank you, Ivan.
Right, so this is mommy's name is Chanel Valdez. She had a little baby girl. This is your first child? First baby, little baby girl, born at 4:52 a.m. Right? And how many pounds she weighed? 2.75 kgs. You multiply her by 2.2. Somebody 2.75 by 2.2. And get it in pounds. How was the delivery? Good? Tiring? Natural? Hello, first try. You going to do it again? But I bet you for asking her one time, she say yes. They tend to forget the pain fast.
So yeah, why say no?
But I bet you'll change your mind in a month's time. Everything went well? What was the baby's name? Anna? Senfa. Very nice. What does Anais mean? Wow. Powerful name. Very nice. Do you have any questions for mommy? For Chanel?
Yeah, you can spell the baby's name.
Huh?
Can you spell the baby's name?
ANAIS. Sempa. Yeah. SEMP. Yeah.
What are your ears?
Pinal.
One mommy from Kaizabad, one mommy from
Were you expecting the baby due time? Do you think today?
and everything went well. Lovely.
So that interesting. Is this our first baby?
Yes, this is our first baby.
So what's the experience, you know? Were you afraid or confident?
What's our first? How long was it? 5.5. 5.5. I was actually expecting to be a whole day.
She's with the family, is it? She's with the family? She's with your family.
So how do you feel to be a mother of second born baby? You ever told the minister was going to come and pay your exits?
So big party by you again, New Year's Day. So Christmas home by you and New Year's going to be a big celebration. Well done, well done, well done. Okay? Alright, so let's set one rest and we have a hamper for you, my dear. Just put it on the table. Hold it. On the
You can't say
very much.
So you will have about 2 more. What of course?
Go from the other side. Go from the other side. Go from the other side.
So this is for you. Alright? All this. Alright. Now we cook it with gas. This is the food for the girl. Of course. Look at spoiled child now. Look at spoiled child. So first grandchild for your mother and first grandchild for the boyfriend, your parent. Look at spoiled. Look at spoiled. Alright guys, let's leave mommy alone now. Alright guys, let's go to number 3. Lead them to number 3 too.
It's tea time. Yeah, this one should be
Agreed. And everybody look up and down now. Lovely. Okay, time for them to feed.
I'm gonna pick up the baby, but she's
Give me the right, Chamoy Valentine, age 29. You want a girl at 6'18". And what are you going to call the baby?
Jafara.
Jafara. What does Jafara mean?
Jafara.
What do you want? You realize all the babies so far get biblical names, eh? Some serious names. Well. Okay, time, right? Alright guys, let's not keep them back. Alright? We just have this for you. Right? Okay? I'm not going to ask you to live it up. Alright?
no, you could just rest your hand on it. You could just rest your hand.
Alright? You're welcome.
So some people want to get a shot, then I'll get it.
Thank you. Okay, keep on. All the best, eh? Right. Let's go on to the interviews.
Response to the New Year babies.
Oh, this is a joyous time to come to San Fernando General Hospital to be here with Dr. Jagannath, who is the head of department, the CEO, Dr. Moore, new general manager of nursing, Acton. I come here for two things. One, to celebrate how Trinidad and Tobago has progressed significantly in the area of maternal health and infant health. Our maternal mortality rates and infant mortality rates have plummeted since 2016 to now first world standards. And it couldn't have been done without people like Dr. Jagannath, the midwives, the nurses. So this is to celebrate the success of the healthcare sector and also with a public holiday to come out and identify with healthcare workers who work every single day of the year. They don't have holidays like I do. So it's an opportunity for me to come out and identify with the nurses, identify with the doctors, the wards maids, the lab technicians. Everyone works on a public holiday to deliver this first-class healthcare. So it's my pleasure to be here on a public holiday.
Minister, we noticed today most of the babies that were born, they're carrying Christian names. Do you think there's any reason why
that is just pure coincidence. But what is significant about the names, they have all chosen names that have significant biblical meanings. And I'm hoping that those names will guide the parents and children throughout their lives. And if I could borrow from the Honorable Prime Minister's Christmas message, where he spoke about family and taking care of your children, I think the Prime Minister's message about that and the names that they have chosen coincidentally seem to collide in a very nice way. And I hope these children grow up to be, productive citizens of Trinidad and Tobago. So they are off to a good start with those biblical names.
Do you know what's the total mortality total and the charity deaths for 2019?
Okay, I wouldn't have that data as yet because 2019 just ended yesterday. So that data will be compiled by the Directorate of Women's Health, Dr. Dialsingh, and I will have that sometime next week.
So 2020, what major significant developments we will see?
2020 is going to be a very busy year in health. So let's see. Infrastructurally wise, you can see we have already started to refurbish the San Fernando General Hospital. We started that, we're going to continue with that. I had given the board that directive maybe about a year ago, because you can't ask healthcare workers to come out of working facilities that are not up to par to their abilities. So we are seeing a totally refurbished all part of the San Fernando General Hospital. Infrastructure-wise, we have to bring on the new Point 14 hospital by around March 2020, which is at about 3 months away. We have to bring on the Arima Hospital, hopefully by around March again, 2020. We will continue with the construction of the new central block in Port of Spain. I have a new Diego Martin Health Facility to be completed by around August, September 2020. We have the new Sando Hospital. So infrastructure-wise, that is what we are doing. But more significantly is policy. In the month of January, I'll be making major announcements regarding how we treat with cancer in Trinidad and Tobago. We have never had an overarching policy to integrate the different aspects of how we treat with cancer. I'll be making a major announcement by the middle to the end of January with cancer treatment, that is one. Two, the decentralization of mental health. There are going to be significant, Cabinet has already approved the policy. Now we are moving to start to implement the policy. There's going to be major announcements on in the area of mental health. In the area of NCDs, and the doctors here will tell you, non-communicable diseases like diabetes and hypertension, you are going to start to see tomorrow, or from this afternoon, a rush to our A&Es. And we're telling you from now, it happens every year. You are going to have a rush to the A&Es because patients over the Christmas and New Year stop taking their medication. They eat too much, they drink too much, their diabetes goes out of control, their hypertension goes out of control, and the descent upon our areas from this evening. And there's going to be this rush. We have to have a policy intervention. One of the things we are doing, which I hope to announce by around March or April, under the non-communicable diseases plan, is to change the drug regime to make the hypertensives and diabetics more compliant. What happens now when I'm a diabetic, so I know, taking medication 2 and 3 times a day, taking a multiplicity of pills, 2, 3, 4, 5 pills, leads to what we call non-compliance. We are trying to move the country under an initiative to redo our formulary, to bring on newer drugs which the patient can take 1 pill once a day. It's called monotherapy, as opposed to polytherapy, which is several drugs several times a day, which does not lead to good compliance. So I hope to announce that hopefully by around March or April, where our patients who have diabetes and hypertension can take 1 drug for the hypertension once a day, monotherapy, easy to comply with, and same thing with diabetes. So those are some major policy interventions we will start to see in January, February, March, April.
Look, you talked about mental health, but on the mental health, you have mental health officers who could go into the public and people who reported, disturbing behavior to be picked up. Now, we have around the cities a lot of socially displaced people who exit certain sites. How come anyone telling these people on your list of the street?
No, that is different. And our line doctor are more to come in here because you have some experience with that. You just can't pick up people on the streets. They have human rights just like you and I. You cannot do that, right? So that is I wouldn't say a false narrative, that's a misinterpretation of the implementation of the Mental Health Act. You just can't go and pick up people off the street.
So there have been reports even from a doctor across there, obviously has got this of a socially displaced man who defecates in front of his window. We have situations where...
So the CEO could speak to that. He is in charge of this facility.
So before you go to that, you talked about all these hospitals will be opening throughout the island. Yet we see in San Fernando General Hospital, patients are still on the corridor waiting on beds and everything. Why is this happening?
CEO can speak to that.
I'm very good today. The Cuba Hospital is able to do that will be happening.
Yes, we are going for an RFP in January for an operator.
In terms of the infrastructure, you're talking about the refurbishment of the hospital and so on. But one of the major issues is the car park.
Okay, you could speak to the CEO about that. It's his facility. I don't run the car park. I am the Minister of Health. This is the CEO.
CEO, your reports in here.
I'm Dr. Brian Amo, Chief Executive Officer of Southwest Regional Health Authority. With respect to the question with the socially displaced persons that we see on the streets, the Minister is right. We cannot make a blanket assumption that those persons have mental health disorder. Normally, the partnerships involve the Ministry of Social Development, the regional corporations, and the Ministry of Health. And based on what the Minister said, it is a human rights issue. We are in a democratic state, so it's always going to be collaborative. In terms of the Southwest Regional Health Authority, we would, of course, liaise with the San Fernando City Corporation. We are part of the national picture. We also have the New Horizons facility in Paro that will work with the Ministry of Health and the Mental Health Unit as well to also help with the decentralization model that the Minister is speaking of. So particular question on the street dwellers, that is collaborative and that will be done on a case-by-case basis.
So how do you get these people on the streets who exhibit these type of behaviors?
Well, as I said, one, it involves the Ministry of Social Development and they will then partner with the Ministry of Health. These persons likely have a case file already and it's not, and it's when you take persons on the street is where do you put them and also to how do you rehabilitate if they wish to be rehabilitated back into society. They have rights, they have their own rights and needs, so it's on a case-by-case basis. So it's a bit difficult to answer and it's not strictly mental health. And that's the point in Ministers.
You can't assume that they are mentally challenged.
Regarding the patients in the wards and the beds, why is it San Fernando Hospital
the San Fernando General Hospital is not only necessarily trying to build, it's throughout the world. About 2-3 months ago, we also had this issue with the global rise in flu cases. So trying to be able, like the rest of the world, as you know, we had a surge in flu cases. In terms of it's a bed management issue and it's a holistic issue. Certainly, with the Southwest Regional Health Authority, with our frontier strategic plan that we're working on, also with respect to the current management and executive that we have, we started with the emergency department. With respect to bed management, we have done some reorientation there in the last couple of months. We're also looking at bed management on the wards, which requires nursing staff as a critical component, and we're also looking at our nursing cadre of staff, so therefore that is always on the active burner. And we're looking at our trend-by-trend utilization. It is very important to preempt what we know is a standard, right? So Minister is right. Christmas we see a lot, we saw very few patients coming, but we know come January they're going to have a rise and a demand on our services. So it is a bit of preparation, but I do think as Southwest Regional Health Authority we are able for it. But just to be clear, it's not only Southwest, but we have been making our strides with the dedicated staff, and yet some processes are change processes. So we are working on it, and we do believe we are on top of it at least for the month of January. We take it day by day, month by month.
Any other questions?
Sorry.
We understand that there's a lot of people using the water taxi. And there's issues that there is, I'm not putting any blame, but there's a lot of people using the water taxi, parking their cars and going to policy. Okay. And they're utilizing the car parks for patients, families and so on.
Okay, well, in terms of the utilization and in terms of having a better track, the Southwest Regional Health Authority is also embarking at this time on a review of the traffic management and parking policy. And we are contemplating getting a professional review of the system in order to move forward. We also had recent discussions with the police service as well in terms of trauma management security services to deal with this issue. So parking is limited, no matter how much multi-story car rise parks you put, is always going to have a demand as well. So what our solution is going to be is again partnering with the San Fernando branch of the police service, and we're working on looking at a professional review of our parking and traffic management, because it's a matter of how people enter to the facility, whether by foot, by taxi, by water taxi, by private car. And the point is that no matter how you come to the hospital, you must be able to bring your loved one or your sick one and get the access to care as easily as possible. So some will be parked, some will be rotating, revolving in terms of the way forward, but we are working on it now as we speak in terms of the parking issue.
But one last thing is, so every year we keep hearing about people like that vaccinated. I don't know if it's working or not. I mean, is there anything else that you're trying and to take children?
Well, let me tell you something. WHO has listed what we call vaccine hesitancy as one of the top 10 global public health challenges. What does vaccine hesitancy mean? It means the unwillingness of people to either get vaccinated in time, to delay vaccination, or not to get vaccinated for any particular reason, be it religious, cultural, or whatever. Every year that I've been Minister of Health from 2015 to now, vaccine hesitancy is growing around the globe. In some countries, they are now prosecuting doctors who peddle their vaccine hesitancy theories. In Trinidad and Tobago, unfortunately, we have joined the list and we have shamed ourselves as a country. Because in the parliament recently, you had a doctor getting up in the parliament, and by his words, the public has interpreted his words to mean that there is this raging controversy globally about the vaccine, and there is none. So we are now shamed. Not the politicians, you have to remember, when you speak in the parliament, and it is carried internationally, you tarnish the image of Trinidad and Tobago. Trinidad and Tobago is now considered in the international medical community as a pariah state because someone got up in the parliament and peddled vaccine hesitancy garbage. And I as minister now have to work double time, overtime to counteract what was said. And if he was reckless enough to say that in the parliament, I wonder what is being told to patients in their offices, discouraging people from getting vaccinated, and then you hold the Minister of Health accountable for that. I ask you, have you in the media seen any raging controversy anywhere in the world about the flu vaccine? The answer is no, and that is what I face. And the population listens to the parliament. And what we saw this year with the majority of deaths, they have come from the East Indian population in South and Central Trinidad, and the characteristic is, the demographic is East Indian, over the age of 60, with what the doctors will tell you is comorbidities of diabetes, hypertension, obesity, and the vast majority were unvaccinated. And that is what we face, and it is becoming increasingly difficult year after year to counteract the anti-vaxxers. They are called anti-vaxxers. It happened a few years ago in some Muslim countries where Muslim clerics were pushing a theory that the polio vaccine was a plot by the Americans to sterilize their children, not to have babies. Do you know what happened? There was a rise in polio. It is so bad in some countries with the anti-vaccine movement that healthcare workers who go into villages to vaccinate people are killed because of conspiracy theories pushed by anti-vaxxers. Healthcare workers are killed for vaccinating people. That is to tell you how dangerous the anti-vaccine movement is. And there is no evidence, no scientific evidence to prove that vaccines are this evil thing. As a matter of fact, vaccines have saved millions and millions of lives. Vaccines have saved millions of children from contracting things like polio, whooping cough, diphtheria, yellow fever, measles, mumps, rubella. But yet you have the anti-vaxxers, and the modern anti-vaxxer is somebody called Dr. Andrew Wakefield. Dr. Andrew Wakefield was a British doctor who claimed to have discovered a link between the MMR vaccine, mumps, measles and rubella, and autism. And he got his paper as a doctor published. Was it in the Lancet? Or the... Anyhow, there are these journals that doctors and nurses read that are the Bible of their profession. And he got it published in a medical journal back in the 1990s. And doctors around the world bought into that flawed report. And when he was asked to produce the evidence, he could produce no evidence. But it was too late, because the population, the unsuspecting parents who are not informed enough, bought into this theory. When his theory was proved to be false, the British Medical Association threw him off the register of physicians. He can't practice. But by that time, the damage has already been done. What is happening globally is that now social media is people with this anti-vaxxer theory are pushing their messages through Facebook, Twitter, and YouTube. And whenever I go as Minister of Health to PAHO in Washington and WHO in Geneva, I bring it up. WHO now is working with Facebook and other social media platforms to screen out anti-vaccine messages because they are a danger to society. As I said, WHO has determined that vaccine hesitancy is one of the top 10 global threats facing the world, and it's unfortunate that Trinidad and Tobago has fallen prey to it. So I just have to work 10 times harder, and I will be on CNC3 tomorrow morning with Dr. Neil Bagwandas of San Fernando General Hospital, talking about how metabolic diseases like diabetes, hypertension, and obesity depress your immune system and make you susceptible to contracting the flu, which can lead to deaths. So my message is, get vaccinated, forget all the reckless talk about vaccines. They are all false. There is no evidence. And as I said on Christmas Day, we have gotten over one hump, but we have another hump to get over, which is the carnival period, when the North Americans come down. If the population does not protect itself now is the time to get vaccinated. You will fall prey to the influenza type A and type B virus for carnival, and we will have more deaths. It's as simple as that. It's as simple as that.
So you spoke about having to go doubly now to allay these fears that people have. What exactly?
Well, again, I have to go on TV in the morning again. We have to ramp up our messages in the clinics. We have to spend more money on advertising to combat the reckless statements being made by anti-vaxxers. And it's a global problem again. But it's unfortunate that Trinidad and Tobago has joined that infamous club of anti-vaxxers.